Good morning, and welcome to another edition of Medical Minutes. I'm Dr. Peter Russotto, your host and moderator. This morning in the booth, I have with me Wendy Smith, who is the Community Program Coordinator here at Passavant Hospital. Passavant Hospital has many support groups available within the community. And I'm going to start with asking Wendy exactly what support groups are available at Passavant.
Well, good morning. Thank you for having me. We have 12 different support groups currently. We have bereavement group called Always in Our Hearts, an Alzheimer's support group, an autism support group for bereaved parents, a breastfeeding support group, diabetic support group, epilepsy support group, grandparents and relatives raising children support group, learn more about diabetes class, ostomy support group, Parkinson's disease support group, and we also have a stroke support group.
Wow, that covers a wide range of topics. I know in the past as a physician, I even gave a few talks with the one that you mentioned, the diabetic support group. In the past, we even had an arthritis support group. We had a post-polio support group. So I see that basically we have support groups and they're changing as the needs of the community arises, correct?
Correct. We try to reflect the evolving needs of the community, and we're always open to any additional support groups that people may be interested in starting up.
So when and where do the support groups meet?
The support groups all meet at the hospital in various meeting rooms, with the exception of the autism support group. They actually meet at the First Presbyterian Church. They have a fantastic room with respite care workers for the children, and so that space works really nicely for them. So that group meets off of the hospital's campus. Also, the grandparents and relatives raising children support group, they actually meet the first Tuesday of every month at the hospital, with the exception of July, August, and December, when they meet at the Community of Christ Church.
How long do these meetings last? Are there any specific time restrictions or?
Most of them last 1 to 2 hours. The groups that meet at noon, which includes the diabetes support group and the ostomy support group, those last about an hour so that people can attend over their lunch hours. A lot of the evening meetings, though, run about 2 hours or so.
And who's the facilitator for this support group? Is that yourself who gets the guest speakers, or is there certain other people to be contacted for this?
So I coordinate the speakers, and I help to coordinate the meeting times and the schedules and the advertising and that kind of thing, but I don't personally facilitate any of the groups. Various healthcare professionals or just some of our support groups are just lay people who have been affected by the particular disease facilitate that. So the Always in Our Hearts group is facilitated by social workers from Memorial Hospice. The Alzheimer's support group is facilitated by a caregiver of someone with Alzheimer's. The autism support group is facilitated by the mother of a child with autism. The bereaved parents support group is facilitated by the mother who had lost her children. The diabetes support group is facilitated by Karen Seibert, who is a registered dietitian, as well as Julie Gound, who is a registered nurse. The epilepsy support group is actually facilitated by the Epilepsy Resource Foundation of Springfield. In Springfield, they come over here and do that once a month. And the grandparents and relatives raising children support group is facilitated by a caregiver. The ostomy support group is hosted by Carrie Carls, who is a wound ostomy nurse. The breastfeeding support group is facilitated by Simone Parlier, who is an internationally board certified lactation counselor and works in the obstetrics department at Passavant. Parkinson's group is facilitated by a couple. He has been affected by Parkinson's disease, and she's his caretaker. And then the stroke support group is actually facilitated by Dr. Meyer, who is a longtime Jacksonville physician.
I'm sure the members of each support group then can make suggestions for certain topics that they might want addressed at their group. Is that correct?
That is correct. I try to meet with them every December and just go over their plans for the following year and then set up speakers that reflect their interests or their concerns or needs.
Generally, what is the big benefit for someone who attends a support group?
So what I hear a lot is that people just appreciate coming to a support group. Kind of helps them feel like they're not alone in whatever they're struggling with. They share that health concern or that interest. A lot of times they can network with each other. They can find out about other resources that are available in the community and just share information and educational resources and that kind of thing.
Sometimes just like saying a shoulder to cry on and knowing that other people are experiencing the same thing is a great benefit to those individuals.
Absolutely.
How does someone register or sign up to attend a support group? Is there certain numbers that you can give us or extensions?
Sure. So if someone has a question about one of the support groups, they can call me. And my direct line at the hospital, the community program line, is 217-479-5800. And I can connect them with the facilitator for the group that they're interested in if they have a particular question. But other than that, all of the support groups are free and open to the public, so they can look online at our schedule and just come to any of the groups.
I'm sure you want to get out to the listeners. They can attend as many as they want. They can miss as many as they want.
Absolutely.
There's
Come and go as you please.
Yes, which is nice, so that way it could fit into their schedule. And I'm sure they can attend more than one if so appropriate, correct?
Absolutely. And there's, like I said, there's no registration required. They can just show up in the meeting room on the date of the event.
If someone has a medical problem or something that they find very interested in their life and they want to maybe start another support group, is the hospital interested in hosting other support groups?
Sure. Like I said, the hospital is always interested and willing to meet the ever-evolving health needs of our community, and we're really committed to meeting those needs. However, the community needs us to do that, and this is one way that we're able to open our doors to the community and just allow them to learn more about their particular disease states. And so if someone was interested in starting another support group, I would encourage them just to give me a call, and we'll see if we can work that out.
And I believe you said that the support groups are listed as far as their times and everything on Passavant website, correct?
They sure are.
How does one know, like, we're coming into the winter months and there could be any type of inclement weather or a speaker can't make it and has to cancel at the last minute? What way do you let the members know? Is there something on the website?
Sure. Well, we actually broadcast that over the radio. If a speaker cancels, generally the support group still meets, and they just have more of an informal group.
Okay, Wendy, I thank you very much. Great information. Is there anything else that you really want the listeners to know, or some special information you want to give them before we close today?
No, we're just thankful for this opportunity to better serve the community.
I think it's a great thing for the people of the community. Support in any type of pathology or factor in your life can really help turn things around. And with that, I close, and I thank you all for listening, and good health